everybody, it's Dr. Joe, and today I'm going to show you 7 ways to relieve knee pain. So let's get started. Disclaimer alert! Disclaimer alert! So the first stretch is going to be a calf stretch. I like stretching my calf on the floor with a strap. You don't have to do these stretches and exercises on the floor. If you have a hard time getting on the floor, especially because of your knee pain, you can do these on the bed, you can do them on your couch. So don't get on the floor if you don't feel like you can get back up from it. I like to place something underneath just right above the heel so I have movement in the heel. If you're on your bed, you can just hang it off the edge if you want to, but that just makes it a little bit easier to get a stretch. You can use a strap if you have a stretch strap. You can use a belt or even a dog leash if you have one. Sometimes the loops make it really nice because you can just place it around your foot. For the calf stretch, you want to put it maybe about the ball of your foot. You don't want it up on your toes because it might slip off, and you don't want it down low because you're not going to get a good stretch. This is a stretch, so you're not actively pulling your toes towards you. You're using the strap to pull your toes and your foot towards you. So you're just going to give it a pull, and you should feel that stretch in that calf area underneath. And the reason this is important is because those calf muscles cross that knee joint. So if they're tight, they're going to put pressure on that knee. So you're just going to hold this for 30 seconds. And then after that 30 seconds, you're going to take a little break in between. You're going to do that a total of 3 times. So the next one is going to be a hamstring stretch. You can kind of keep it all in this position. The reason you want to stretch your hamstrings is kind of the same thing. The hamstrings then come down and cross that knee joint. And so you really want to make sure it's stretched out as well. So you're just gonna lie down now, and again, you can keep the strap in the same position. You can even keep that roll there if you want to. I like to prop up the other leg just to kind of take some pressure off of your back. Some people like to straighten it out because they feel like they get a better stretch. With the hamstring stretch, you always want to keep your knee as straight as possible. So if you're coming up and your knee is starting to bend like this, you're not going to stretch those hamstrings. So make sure you only come up as high as you comfortably can before your knee starts bending. So if that's only to there and you start feeling that stretch, that's okay. Hold it there. Don't try and force it up and then your knee come up, because then again, you're not getting that stretch. If you come up and you're getting a pretty good stretch and you want to get that calf a little bit as well, you can just pull your toes there as well. But sometimes I feel like if you're doing that, you might feel your calves a little bit more if they're tighter. So just keep a kind of a neutral bend in there and then bring it up until you feel that stretch. And then just hold that stretch again. It's a 30-second stretch, and you want to do that 3 times with a little break in between. So the next one is going to be a quad stretch. So same kind of thing. The quad's really important in knee function because that quad comes into the tendon that's attached to that kneecap. So if it's tight, it's pushing that kneecap down into the joint, causing a lot of pain. So with this one, you're going to roll over onto your tummy or in prone. So I'm just going to switch sides, but of course you would just still do the same side that you need stretching. Some people leave it on their foot like this, which you can do, or you can bring it all the way around to your ankle. So you're just going to roll over and kind of bring the strap up and over your shoulder. That's going to give you the best way to stretch without kind of messing with anything else. Now, make sure you're comfortable. I'm going to prop up just so I can see you, but make sure, if that's uncomfortable, lie down. Don't stress out your back, just trying to stretch out your knee. So an extra tip here is bring your knees close together. This is going to help get that quad stretch a little bit better. So usually if you see my videos, maybe they're a little bit further out, bring it a little bit closer together. And then when you come up, try and squeeze your knees together while you're coming into that stretch. Once you get to wherever you're feeling pressure but not pain, hold that there and then try and tuck your booty in, almost try and squish your tailbone in, and that's going to give you an extra stretch on that quad. So again, holding that for 30 seconds and then coming back down. So that extra squeeze just rotates that pelvis to give that extra stretch on that quad muscle. So again, 30 seconds, 3 times. So if you're having a lot of knee pain, maybe you have a specific injury, something like you've had a surgery, an ACL repair or something like that, and you've been in a big brace for a long time. Sometimes you want to do a transitional brace from a little bit of support right before maybe if you just go into a sleeve that doesn't have any support at all with just the compression. And the folks at Bracoo sent me their KP41 Patent Athletics knee compression sleeve. A lot of words there. But what's really cool about this knee sleeve, compression sleeve, is it has some extra stabilizers and support on the inside, on the sides, the lateral for stabilizers, and around the knee cap or that patella. And so what's great about this is a lot of times, especially if you've had a surgery, you go from this long, huge bled-so knee brace where sometimes you're even locked out into that knee extension or straightening for a period of time. And then you just kind of get out of it and it's like, okay, we're going to keep on doing our therapy and everything. So if your physical therapist or your doctor thinks it's appropriate, you can transition to this sleeve to still have some of that support where you're not nervous about something bad happening, but you're not having nothing there. So it's a nice way just to progress into doing stuff. And it's great because you can still do the work, you can still do your exercises and stretches if you need to with it on. If you're in therapy, they'll usually have you take it off, but if you're doing your exercises and stretches at home. So what you can see here, I'm going to flip this around and show you because I think this is really, really cool. For something like maybe Osgood-Schlatters disease, if you have some issues with that kneecap, a lot of pressure on it and it causing that pressure on that tuberosity right there. This silicone patella ring right here, as you can see, it has that opening to help make sure it's not putting too much pressure on the patella there. But what these wings do, and they should go on the outside, so it should be on here like this. The top wing kind of helps with the IT band that comes down into the knee. And then the bottom wing down there helps with the meniscus or the lateral collateral ligament. So it's just kind of gives some extra support there. What's really cool is the sleeve. You can then flip it over. So you can use it as the right or the left. So make sure you look at this to see which side it's on because you want these to be on the outside or the lateral side. So that's important as well. So I'm going to put it so it's going to be on my right side. And you can see here it's got the spots for the wings as well. And so I think that's a really cool component because it gives you, again, that extra support in there that you might want instead of just coming completely out of a brace that maybe you've had for 4 to 6 weeks and you're just maybe a little nervous or uncomfortable. You know, something like a meniscal repair. Again, that ACL is usually those big ones. But you can even use it for something that's not a surgery, so something like patellar tendonitis. So again, this is going to really help kind of support the patellar area. So if you've got that irritation, it's going to give you that support you need to help heal. You can also see on the outside here, that's where those lateral or those side stabilizers are. Again, it's not a bar anymore, so it's not going to be that crazy support, but it's just going to be almost like what I like to call like a reminder. So if you're working, you're exercising, you feel your knee go out a little bit, it's going to give you that little bit of feedback where you go, okay, I need to make sure I'm activating my muscles a little bit more to get that movement in there. So I'm going to put this on and I'm just going to show you what it looks like, and then I'm going to do some exercises with it as well. So you can see it slips on really nicely, and I want to make sure that my kneecap or my patella is in that kind of that whole area. So then you're not having this put pressure on it. So it comes around, it feels really nice. And what I was surprised, because when I got this, I was like, oh, well, that silicone's not going to be a whole lot of extra support, but it really gives me a lot more support than I thought that it would. So it's not, again, those bars, which does all the work for you, but it's kind of that reminder, just kind of helping it go to where it's supposed to go, helping those muscles figure out what they're supposed to do. Also, the material is a tri-weave material, which is really breathable. If you're like me, those neoprene sleeves, I'm not a huge fan of because you end up getting really sweaty with them. But this has that kind of wicking away the moisture kind of component to it. So I really like that. And it's nice and soft, and it's not that irritating kind of material that some sleeves are made out of. And so I really like that component as well. So if you're interested in purchasing the sleeve, make sure and click on the link up there or in the description below. So let's go ahead and do some more exercises now that we did the stretches, and I'm going to do them sitting in a chair. So The exercise that I'm going to do next is a seated knee extension, or sometimes we'll call it in the clinic a long arc quad. So sitting in the chair, you want to make sure you're sitting upright and you have your hips at about 90 degrees, have your knees at about 90 degrees, feet nice and flat on the floor. And then all you're going to do is just kick your leg out, extending that knee, and try and get it as straight as you can. I like doing a little pull of my toes at the end just to really help kind of squeeze and get everything straight, as long as it's comfortable. Just a little 2 to 3 second hold, and then nice and controlled coming back down. So you don't want to go fast. You really want to control this movement. If you're going fast, then you're just using momentum and it's going to be easy and it's not going to be hard at all. If this gets to be pretty easy, if you're doing 20 to 25 and you're not feeling much, you can add a little ankle weight. But again, more slow and controlled is the way to do it. That's what's really going to activate those muscles, work the muscles. So I would just start off with 10 to 15. You can do a couple sets, a couple times throughout the day. So then the next one is going to be a seated hip flexion. And so the hip, even though this is working the hip, some of those muscles come down to the knee. Part of that quad is at the hip and at the knee. So you want to make sure you're working all of those muscles as well. So this time, same kind of thing, make sure you're sitting upright. And now all you're doing is just like you're trying to bring your knee up towards the ceiling. So same kind of thing, go slow and controlled. Again, for some people this might be easy, but for some people this might be a little bit challenging. You might not be able to bring it up really high, so making sure you've got that full motion is important as well. And then again, also, if you can get to 20, 25 and it's easy, you can add a little ankle weight on there. But I would really just start off with 10 to 15, that, a couple sets, 2 to 3 sets, a couple times throughout the day, just to make sure that you're trying it first and then seeing how you feel afterwards before just going and doing a whole bunch and then end up doing too much. So the last exercise is going to be a sit to stand exercise. So with a sit to stand, this is kind of a precursor to a squat. So you really want to be nice and controlled, but you have the chair, you sit all the way down, but you're not going to plop down. Because a lot of times with knee pain, that's a big thing for people. They have a hard time controlling the descent to sit back down. So a couple key things when you're doing a sit to stand. You want your feet to be about hip to shoulder width apart. Sometimes a little bit wider is better because that's going to give you a little more base of support. You want to scoot to the edge of the chair, and your stronger knee is going to be back behind you. So I would actually switch a little bit if my left leg was my stronger side, just because that's going to take a little pressure off of here. So to start off with, you want to do that, and then eventually you can bring your feet back together. And then all you're going to do is lean forward and come up into that position. So see, I'm pushing off more with my stronger side. Same kind of way coming back down. You really want to control it back down. You're going to stick your booty back like this instead of just coming down and plopping down. This is what I see a lot of people do, because all their weight is back behind them. But what you want to do is stick that booty back and really control it down, finding it. So you shouldn't hear a whole lot of noise when you're doing it. If you can do that a couple times in this way, then you can bring your feet back together and just do a sit to stand this way. So again, you're coming up nice and controlled and really stick that booty back and come back down. But see, my knees aren't going in front of my toes. All the work is at my hips. I'm coming up and then coming back down, really sticking that booty back. So I would just start off with maybe 5 to 10 of these, making sure you're doing the correct motion, making sure that your knees aren't going in front of your toes. Have somebody watch you so they can tell you, say, oh, your knees were going way in front of your toes, because that's going to put pressure on your knees. And then if you get that down, then eventually you can take away the chair, or the chair can still be there and you can just squat down and not actually touch it, but it's there if you need it. So just starting off that kind of modified way of doing it and then progressing your way up. So there you have it. Those were 7 ways to relieve knee pain. If you're interested in purchasing the Bracoo compression knee sleeve, make sure and click on the link up there or in the description below. And don't forget to subscribe by clicking down there. And remember, be safe, have fun, and I hope you feel better soon.